I'm your host, Karishma Dean. Today we have a remarkable woman who is in the business of achieving. At a time when society was not in the business of helping women, she not only got her bachelor's, her master's, she received her Juris Doctorate, and that last one she did while she was having children. So if we could just welcome LeAnn Wheeler.
I'm glad to be here. Thank you.
Of course, of course. So I'd just like to start out a little bit about you. Tell me about where you grew up. Tell me about where this insatiable feeling to be an achiever came from. I mean, because not everybody is. You are one of those kind of people who is just like, let's get her done.
I enjoy doing things. I enjoy school. And I was raised outside of Ogden, Utah, in a rural community, Harrisville. And it was just kind of a time slot in history that I had a lot of family nearby. My grandmother lived on one side, my aunt and uncle lived on the other side. Between us and the church, which was about 3 blocks away, I had like 7 houses of cousins, second and third cousins that we grew up with.
I love that so much.
It was beautiful. It was, and we'd go out the door in the morning, and my mom didn't worry about us. We were down in the jungle in the gravel pit, and we just took off. We played games at night with the neighborhood. Something that was a very cherished.
That is not something that happens anymore. As a matter of fact, we have reverted back completely to the opposite of that. Everybody is within the confines of their home. They don't even know who their neighbors are. They have play dates that are scheduled. So what a freeing and liberal way to just grow up and to learn skills that kids don't learn right now. I mean, our kids right now are pretty lacking in that. So
I agree that kids benefit greatly
oh
from
my
being
gosh,
outdoors.
and you had instant playmates. Exactly. I guess the only downside would be if you upset Johnny and Johnny's mom had to, or did you guys just work that out yourselves?
We worked it out. Mothers didn't get involved, except the time that Joe Shirtliff threw a pitchfork and hit my brother in the head.
Oh, yeah,
and
somebody had to
he
get
comes home streaming blood. My mom wasn't mad. She just had to get involved by taking him to the hospital.
That's funny. Just different times, different times. So growing up in the 60s, I just need to know, because that is a completely different time. I know that it was like a shift, right? We had societal shifts in like paradigm shifts.
We did.
But not necessarily, they didn't manifest right away. You know, society was still holding on to this is what women do, this is how women are. So how did you have this thirst for education? And it was like you didn't look at the world as barred or boundaried. You saw it as limitless.
I think both my parents contributed to that. My mother used to say, do everything you want to do. You know, you're married a long time, it's wonderful, but experience things, go out and try things. And my father was always saying, you can do anything in this world you want to do. And so I had a lot of encouragement from both my parents.
Which is true, you can do anything you want. You can try anything you want to do. Someone actually said something very profound the other day. They said, you can't be anything you want to be. You have to figure out what you're good at and then go do it.
Maybe
right?
That's it. I just did the things I
You
was good
did all
at.
the things. But it seems to me you were good at everything. It seems like you were good at everything. I mean, you're pretty remarkable. So tell me, what was your first job?
Well, my father, when he was in the Navy, he was working in the chefs for the officers, and they came in recruiting somebody to be a barber. The barber had gone home because of a death in the family. Mm-hmm. They were on a ship in the Pacific. They were out at sea. And they said, we need a barber. So he said, I'm willing to try it. And so
sure.
He'd been raised on a farm, always assumed he'd be a farmer. Mm-hmm. But after the war, he used his GI Bill to go through school, and he trained as a barber, beautician, and he went on to start a beauty college and 5 or 6 salons. And so
incredible.
From the time we were little, we folded laundry, we helped with the bookkeeping,
right.
We helped with cleaning the salons.
Well, because you came from a big family. How many kids?
7 kids.
7 kids, and I love that they let, I don't know, did they let you? Did they encourage? Did they expect it? Like, was it just a, hey, you're in the family, we all have to pitch in?
It was, the towels need to be folded. You're the one.
You over there, you're the towel folder. Get over there.
Yeah.
I love that, because now we have this idea, and I'm just trying to set up, like, you are a go-getting, persevering, tenacious personality, and we aren't raising people to do that, but this is what creates progress, technology, advancements, this kind of personality that you are.
I actually see quite a few high-achieving people.
You do. You surround yourself with high-achieving people, but on the flip side, we've got a lot of people who won't work, people who, we know several people actually within our own vein of people who are like, I can't work because my anxiety is too much. Or I'm like, what about your hunger? Do you feel hunger pains? Because how are you getting fed? How are you know what I mean? Like, there's got to be some kind of survival instinct, which seems to be negated right now. And I don't know if it's because of governmental influence, I don't know, but at the time that you were being raised, the government, there wasn't the kind of scaffolded welfare system to help really anybody. You were kind of on your own.
Except for family. You had
Family,
a lot of
of course,
support.
family, but you know.
It is really tragic. I mean, there's a lot of anxiety, and I don't know if it's from social media or what this, probably, as you said, being able to be outside on your own and learn
Yes.
that you can cope.
Yes, having some skills. So you acquired quite a few life skills just growing up.
To survive.
To
Yes.
survive, but also you did have that tenacious personality. So let's segue into what that meant. You and your husband have 5 kids. You both have your Juris Doctorate. He's also got his degree in business. You've worked on Wall Street. You've worked as a court clerk for the Supreme Court of Colorado. I mean, you've done some amazing things, but today I really want to focus on the life-saving thing that you came to know that was manifest through your own personal. Give me a little bit of background on your family's health.
Okay, I have a lot of heart disease in our family and strokes. They're manifest in the same way because they're both vascular diseases, very closely linked.
Right.
So I came from a family where this was impactful at a young age.
Right.
My grandmother had a stroke at 53. My father had a stroke at 53. He was paralyzed on his left side for 10 years. My brother, excuse me, my brother died during what should have been a routine angiogram placement of a stent. So I saw the impact of heart disease early on.
Right.
And I tried to be very careful to try and eat well. And I mean, I wasn't perfect by any means, but I was trying to exercise all the time and eat well.
Well, but you're an active person. And I think on most levels, if you're out hiking and biking and you've got kids you're chasing around, you and your husband are not super sedentary people. You are explore the world kind of people. And I mean, you're certainly not overweight, so I can understand why you're like, man, I was doing all the things that should be healthy.
I thought I could avoid that gene, whatever it was in our family. So anyway, yeah, I was surprised. I had went to a cardiologist in the spring of 2015 and just said, you know, with my family history, I was 67 by then. I said, I just want to make sure. So they did all the tests. I went to multiple doctors, endocrinologists, urologists, kidney
So you were very
disease.
preemptive.
I was trying. And they said,
impressive.
everything looks great.
That's
you don't need to
impressive.
worry. So that summer we were hiking in the Alps with our son and his new wife. And I started to get short of breath and started to, you know, kind of have chest pains. And I thought, oh, it's the altitude. It couldn't be my heart. It's the altitude.
Because I just went and got checked. I have
Yeah.
a clean bill of health.
I'm clean. This is not what it is. I'm not worried about that. And so then about 4 months later, I had just walked in the door from visiting a friend. My husband was at a dinner. And so I was home alone. I walked in the door and it was like I got hit in the back with a baseball bat. I had never experienced anything like it before. It was, I was sweating, I was, throwing up. I was very, very, and when they describe, when you see pictures of people clutching their chest,
Right.
that's for a reason.
Well, but I mean, and they, Hollywood makes it obviously, I think they leave out a lot, because it wasn't until I read a book and someone was describing a heart attack, how they lost all their faculties of their body. Like they literally couldn't, you were saying you were throwing up, you couldn't stop yourself. There was just this horrific takeover of your body.
Well, you're kind of in shock.
Yeah.
I think as much as anything, you're in shock. And I just kept thinking, all right, what do I do? What do I do? And luckily, a voice just kept saying, get to the hospital now, which is logical
prompted.
under the
Right.
circumstance.
Don't stay home.
So actually, I called my neighbor who's a nurse and a good friend, and I said, I need to go to the hospital. So she ran over and she said, what do you want me to do? Do you want me to drive you? Do you want me to call the ambulance? And I said, call an ambulance, but tell them to turn their sirens off.
Oh.
You're still thinking about all these things. And so
You're funny. You're a funny lady. That's funny.
I didn't want all my neighbors running out the door going, oh no, LeAnn. So anyway, and afterwards I found out that my one artery was 100% blocked, the other one was 95% blocked. So I really was in crisis, but I hadn't realized it yet. You're still thinking,
How did they miss that? You just went in and had everything checked. How did they miss that?
well, sometimes it's inflammation, and soft plaque is actually more dangerous than hard plaque, because the hard plaque has got a coating on it. And so the soft plaque can flip off little particles of fatty tissue and stuff like that. And I had bronchitis a month before, and my cardiologist said it could have been related to that. But I had to have had that plaque.
That had to have been there. You're 100% blocked on one and 95%. I'm just thinking, somebody missed the memo. I don't know. This is like...
They really can't tell until they go in with a camera, until recently. Now they have Cleary scans that they can go in and they can see that plaque. So we're making real progress there.
That's good.
But when I got to the hospital, I still had not fully, I was thinking, I don't have time for this. I'm too busy. I have so much to do for this
There's that
leadership
personality
conference.
coming out.
And I didn't realize until they were I was on the gurney, they were running down the hallway, cutting my clothes off, and I suddenly thought, oh dear,
this
they
is
really,
serious.
yeah, this is really serious. And so I said to the nurse who was nearest to my head, I turned around and I said, you think I'm going to die, don't you? And she said, oh, we don't say that. We don't talk like that. And I'm going, okay, well, just in case. So I was telling her that, I said, if I die, because I was thinking, I can't say goodbye to anybody. Nobody knows I'm here.
Exactly.
So I just said, tell my kids I love them and goodbye. And my husband, I said, and she just kept running.
Note to self, but you're not going to die. Okay. Bad juju.
So anyway, that was kind of set the stage for it. And then after that, I had 3 more heart attacks. I had stents. I had finally a bypass heart surgery, and it failed.
All of them failed.
It failed. They would open up my artery, and 5 minutes later, it'd be blocked again. I found
And that's genetics.
it's genetics.
I mean, because truly, you weren't eating inappropriately. You were well exercised. You were living a very healthy life. In fact, you were living a life that most people do not live. So genetics very strongly pushing this disease. And so then what happened after they said, okay, we've done everything for you?
Well, I realized I needed to do more testing and do more aggressive investigation, and so I went to a functional medicine doctor. He tested me, and one of the tests came back that I had elevated LPA. It's lipoprotein small a. And if you have heart disease in your family, you want to be tested for it, because one out
You
of
say
the
that just one more time. Just one more time. It's very important that you get this. It's very important.
lipoprotein small a is what they call it. There's a large A too. But what it is it's a derivation of a gene that is a sticky cholesterol. That's what they call it, is a sticky cholesterol.
Interesting.
And so when it's in your system, it clogs up and it attracts other things that clog up. And it's just simply some kind of genetic mutation. A normal level, there are two different standards that they work by. One is if you are over 125 nmol, and mine was like 170, which is not as high as some people's, but it's
Right.
anything over 125 is a problem. And so that's why we're working it.
And due to the fact that they didn't have, until now, the diagnostic ability to be able to see this. Why? Can you tell me? You mentioned that that it's so infinitesimal to see.
Well, it's just something that's in your system. Europe tests people for it by the time they're 18. The United States doesn't, even now.
Why?
Well, one of my cardiologists said to me when I said that, I said, how come I haven't been tested for it? How come we don't hear about it? And he said, well, there's nothing we can do about it. But that's not true, because
There's
you can...
nothing that we want to do about it.
Well, diet doesn't change it. Exercise doesn't change it. It'll move the marker, maybe 10, 15% is all. But they are in the last stage of drug trials. You'll hear a lot about this because there are new drugs coming out for it. As soon as we have drugs for it, you're going to hear a lot about it.
Right? Yeah, right,
And
right.
they're starting to test people, but they estimate now even that maybe 3% of people have been tested for it.
Oh, wow.
My siblings, after I found out I had it, I told all of them, I have 3 living, and I told them, you need to go be tested for LPA. So they went to their doctors, and the doctors actually argued with them, even knowing they had a family history. I don't think it's necessary. It's not likely. All 3 of them have elevated LPA, and 2 of my 5 children do.
So you know that I'm an advocate. I believe in advocating for yourself and for your loved ones in the healthcare system. I believe that strongly. I cannot tell you enough, and I always say this. You should never go to the doctor or the hospital alone. But in that instance, your siblings had to advocate, no, I need this. I need this testing. And it's hard to do that with someone that we all revere as an all-knowing doctor. It's very hard, but important.
Yes, doctors are wonderful at what they do.
Sure.
They're well trained, but they don't know everything. And
No.
they don't know you.
Exactly.
They don't know what's going on. And if they haven't realized in the past that this is significant and that it can have such a great impact.
Right.
Because LPA can cause you to have a heart attack even if there are no other symptoms in your life. Even if the rest of your family, I mean, you know, it's genetic, but it doesn't necessarily manifest in everyone.
Right.
There are some countries with a very high level of elevated LPA, and they never have heart attacks because of their lifestyle. So it's kind of a
strange.
puzzle. I call it
Humans are a puzzle. Humans are complex in every way. You can't, there's no tried and true. So then what in all of this, you got tested, you have all this information, the cardiologist says?
Well, my cardiologist didn't know what to do. In fact, my cardiologist told me after my failed bypass, he just said, there's nothing else I can do for you. He said, we can't put more stents in, there's no artery there. There's no connection to do another bypass. So I was baffled. I was wondering, okay, what does this mean for my future? And he said, I can recommend you for 9 months of cardiac rehab, and what I want you to do is I want you to exercise really, really hard until you have chest pains, and then stop immediately. And then wait until they're gone and exercise really hard again. Well, that is fine, and that is one approach, but I started doing a lot of research and a lot of study.
Right.
Research is my background, and I love learning anyway, so I started studying a lot. And actually, flew to Michigan to talk to a preventive cardiologist because he knew about LPA.
Wow.
And I went expecting to learn what to do about my LPA.
Right.
And when I got there and he reviewed all my records, this is a man who had been, top in his class at the University of Michigan. He had done a lot of surgeries, thousands of surgeries. And about 10 years ago, he decided, I don't want to keep seeing the same people over again.
Right.
I want to help them avoid it.
And it's got to be difficult as a healer, a doctor, to have to say to people, there's nothing I can do. I mean, how crushing is that? I mean, that has to be worse than watching a patient die because, I mean, you've done everything you can and they died. But to actually sequester them too, however long they have, that's terrible.
It's sort of like you're waiting to just kind of continue to decline. But yes, and I have a wonderful cardiologist. He was so kind and thoughtful, and he saved my life. I mean, there's no question about it. He saved my life more than once.
He did everything he could.
Right. And, but when I went to talk to Dr. Khan, I was surprised because his advice to me is find EECP. And of course I'm going, trying to write this down. Would you repeat that?
What? EECP.
Yeah. And so after I left his office, he said, I think there's a clinic in Denver. And so I started searching for first of all, information about it.
Right.
And just briefly, it'll sound like a catalog, but it's been around since the 1950s. Wow. And we invented it. The Americans are the ones who thought, wait a minute, we ought to be able to help the heart work better from an external treatment.
Right. Of course,
so,
of course.
Dr. Kanitritz did some research with it. He came up with some models, and actually it's split off. You ask any medical professional, and they know about aortic balloon therapy. If you're in the ER and your heart's not working, that's from his research. Okay. But the other angle of it was the external part, to have the cuffs, and it's really a system where you have 3 cuffs that are synced to your heart.
Okay.
So you have EKG leads on. Every time your heart beats, well, when your heart beats, if you don't mind a little explanation.
Sure.
When your heart beats, it's pushing blood out to the rest of your body. And then it relaxes. And then your body has to push that blood back in through the action of the heart. It's pulling it back in. And that's when the heart gets nourished. And so what EECP does is through these synchronized compression booths, through the EKG sync with your heartbeat, every time it relaxes, then it pushes the blood back in. It's almost like a second heart.
I love it. Okay, so I've seen this machine, and it looks like, I know we've all seen the compression boots, right? That come all the way up. This machine is pretty much for the whole body. So what happens when it pushes that blood back in for the heart? And tell me kind of that experience. Well, that's when the heart
gets its nourishment. That's when it gets the oxygen.
And this machine pushes in more of the nourishment to the heart, which is what it needs.
And so the heart gets stronger.
Okay.
It doesn't have to work as hard.
Okay.
And so it can, continue to do its job more fully than it would have otherwise. And because of this action that is called a shear stress, it actually improves your endothelial tissues, and it creates nitric oxide, which helps you grow new arteries.
In your particular instance, you had exhausted everything. There was no more artery to put a stent. There was no way to connect it so that you could do a bypass. You were done. What you had to have was something new growth. And that is what the EECP machine did for you.
Yes, because the fact that I don't have a right artery anymore, and my left descending artery, they call the widowmaker, was still 75% blocked, even with 4 stents.
Right.
And so I needed to have more arteries, and it did. And the marvelous thing about it,
That's fantastic.
It was amazing.
Yeah.
I started therapy, and at first it was the clinical director of Vaso Medical that holds the patent on the machines said it is like running a 5K for people who can't get off the couch.
Right, this is what you mentioned. So, I mean, it's hard to say to someone, you've got to exercise when they're like, I
Or they're
am
in so much pain.
exhausted and I'm in pain and I can't get off that, because as we've talked before, you've mentioned different people who are, it was all they could do to get up from the couch, walk to the bathroom, take a break, and then get up the energy to come back to the couch because they had been put into this there's nothing more we can do category.
Yes, just absolute exhaustion.
So the only thing they have to do in this machine is lay there.
They just
lay there.
Yeah, and you know, some people complain that it causes a little bit of bruising or a little bit of too much pressure, but you can compensate for that by putting padding or adjusting the temperature, not temperature, excuse me, adjusting the pressure and the way it's wrapped. But what I found is that I was exhausted the first week. I mean, I was so tired because it is just like exercise.
And you did this every day for an hour each day?
5 days a week, that's the protocol.
Okay, the protocol is 5 days a week, an hour each day. For how many weeks?
For 7 weeks.
7 weeks.
And this has been tested in hundreds of studies. It's FDA approved. Medicare will pay for it if you're an end-stage heart patient.
Okay.
Unfortunately, we don't use it earlier. In China, they picked up on our invention and they perfected it.
They always do.
And so they have been using this clinically to help people since the 1960s. So a lot of the studies...
And it is part of their health training and part of their education.
It's part of their protocol that before you do stents, you consider or you do EECP. They have colleges that all they do is train therapists to do EECP. Yes.
But they don't just use it for... So in talking to you in the past, you've mentioned that they use this to improve athletes and their performance, and this can be used just as a health incentive, which is interesting to people like, I don't have time to lay for an hour 5 times. You go to the gym and you want results within a few, this is 7 weeks. 7 weeks, I mean, I don't know of any gym that's going to tell you in 7 weeks you're going to have this kind of a result.
And we can't just go for the easy fix. I talked to one cardiologist on this walk for a doc, and he was affiliated with the clinic that I finally was able to convince to treat me, because they usually just reserve it to their own patients. And it's a money loser. They don't want to do it. They don't want to be bothered.
Heaven forbid. Heaven forbid it doesn't make $1 zillion, but it saves lives.
Yeah. So I asked him, I said, we were walking, and I said, do you know much about EECP? And he said, yeah, I've heard about it. He said, you know, they used to talk about it more 15 years ago. And I said, well, do you mind if I ask, do you refer people to it? And he said, no, not really. And I said, okay, explain why. And he said, well, we have all these new medications. And the medications will help resolve the symptoms.
Pharma. Here we go.
So meanwhile, their arteries are continuing to deteriorate, but they don't feel it. And people are happy because they can take a pill and they don't have to go to the gym. They don't have to go to rehab, I guess. I have a very different view of this. If you ask me, 35 hours seems like nothing in comparison to recovery.
35 hours is nothing. It really is nothing. I mean, I myself have done hyperbaric chamber, which is completely different, but I know that there was a set amount of time I had to do it to have a result. And based off of the trauma in my brain, I needed that, you know. I guess you have to weigh your priorities. Do I want to feel healthy and get back to my lifestyle, or do I want to sit on the couch and pop a pill? I'm curious as to whether that cardiologist could state whether these people were happy because they weren't in pain or because they could get back to their activities. That's something that I would like to quantify. Were you able to get up and walk around? Were you able to go chase your grandkids? Were you able to go back to whatever it was you were doing before all of these issues with your heart?
And at one point, I was on nine different medications.
Sure.
And
we're not anti-medication. We're just a little bit anti. And why would you choose this over this when you have an option?
Because your doctor tells you to.
Yeah.
And because you don't know there's another option.
exactly.
And I thought it was unique. When I found out that my artery had failed, naive, I really thought, this can't happen to other people very often. I haven't heard of this. This has got to be rare. As I started looking into it, they estimate there are between 500,000 and 1.8 million people.
Oh my goodness.
And they even have a name for it. It's called the no options patient.
I was going to ask you about that, the no options.
The
That
very
is just the
fact
worst
they have a
possible thing,
name.
and that's the worst name you could say. Like, and we're done with you.
Well, the other
There's
thing
the exit. I mean, like, what?
The other thing they call it is even worse. They call it end stage.
Oh.
End stage heart disease. So you're either end stage or you're no options.
Okay, no option is a little less.
But can you
I guess.
believe they have a whole category? They know they're out there. They have a classification for it.
And they wouldn't. Here's where this is where you're losing me, and the cardiologist has lost me. So you can't do any more for them. Why wouldn't you refer to this machine, this procedure, this treatment that has been proven, it's got the track record, it's FDA approved? What would be the downside? Are you worried that you want to save lives, right? That's my question. We're in the business of saving lives, right?
Yes.
Woo!
I think it's a combination of things. I don't think it's bad ulterior motives. I think that they are
indifference.
They don't know about it. They don't teach it in medical school, and they don't treat it in continuing education conferences. Many of them are paid for by the drug companies.
Oh,
and so
yes.
many of the doctors...
Conflict of interest.
You talk to a lot of doctors and they've never heard of it. They don't
see.
even know it exists. But it was FDA approved in 1995.
This is what I'm trying to like.
Yeah.
So that's crazy to me, and being used throughout the world in various places as part of their protocol. That's another thing that's very confusing. But so you found this treatment, you've used this treatment, it has done well, but there are not, and obviously because it is not well, the information's not proliferated, it's not well acknowledged, but how many places can you actually find one of these machines?
Well, when they first started distributing them around 2000, right, when the FDA approved it, Medicare approved it, Medicare. I mean, they are so
I
conservative.
am totally hearing you.
Yeah.
I'm like shocked as well. I'm like, what is going on?
Yeah, and they will pay for it if you're end stage. But what happened is, just a little bit of context is, when we invented this, and I take ownership for it. I'm so proud that we invented this machine. We're very creative people. But when that started to take off, that's just when open heart surgery also became very prominent.
Oh, got it.
And so the Chinese went with the clinical
EECP,
side of it. We went with the stents and the open heart surgery part of it. And so doctors who don't know about it don't learn about it. And the other thing is they're held to a standard of care. You know, you come to them and you say, I have chest pain,
Right.
and they can't see it, or in the past they haven't been able to. They're protecting themselves by saying, 9 out of 10 will have open heart surgery in this case.
Right.
9 out of 10 will have stents. We will do stents.
Right.
And it's what they're trained to do. It's what they're good to do. You know,
Right.
the old hammer and the nail.
Exactly. So you found how many of these machines?
Oh, I'm sorry.
Given that,
the clinics, not many. There used to be about 2,000 machines in 2003. Now they estimate there are approximately 130 in the United States.
Why?
Well, it goes back to the doctors and not knowing
Okay,
and
yeah.
not using it, and that we do pay per treatment. And so we have gone that direction. But one of the things that really strikes me is that, to me, it's more like urolosis and dialysis. That if you have a urologist, and he is really, really good. Dialysis used to be done in the hospitals.
Right.
But now it's done in private clinics.
Right.
And they can treat many, many people. They
All at
perfect
one time.
it.
Yes.
Right. So you don't expect a urologist to be doing dialysis.
Sure, that does make sense.
So
yes.
what I think needs to happen, and I really am hoping to change the medical community,
Right.
is I am hoping that we can do EECP for the millions of people. I mean, there are many people who are not already
We
no
know
option.
of 1.8 million, but we don't know of all the people who haven't been tested. In fact, if we were to combine that knowledge and the precursor of testing people, they could have the option to then use the EECP and prevent things from even getting to this end stage that they would need.
And new research just came out. In fact, there was a study published in November 3rd of 2025, like a month ago today, it came out. They presented at the American Heart Association scientific session, and their study showed that people with arteries that are 100% blocked, who did not have stents, did not have bypass surgery, 100% blocked. And I don't know what kind of pain they were in meanwhile, but
they had to have been in some pretty rough, that had to be rough.
Yeah.
That could not have been good.
These people were treated with EECP and their blood flow increased. They grew new arteries. And the part of their heart that was not getting oxygen, they had 20% that was not getting oxygen, it went down to 3%. And so what the conclusion from these scientists and many
American Heart Association.
American Heart Association.
Yep.
American scientists at the University of New York. And they said, in conclusion, that for people who do EECP first, who have totally occluded, totally blocked off arteries, may not need to have invasive procedures.
Ooh.
I know.
Do they really want to say that out loud? You know,
it
may
is
not have to have surgery.
Landmark. It is.
That is amazing. That is amazing. So you touched on what your goal is. I want to extend that. You want to, in the next 5 to 10 years.
Okay. I have to first of all say, I have proof myself that this happened.
Right.
Because of the fact that after my failed bypass, my cardiologist was very nervous about my heart, and then I ended up in the hospital again with a drug reaction. It was simply a drug reaction, but he said, you can't tell chest pain from drug reactions, sometimes from real problem. And he just said, I really need to go in and look at your heart again. And so this was just in 2024. He went in with another angiogram. He came back to my hospital room, and he said, I have to show you something. And he had my before angiogram that had been done shortly after my first heart attacks and so forth, and he had my new one after EECP. And my new angiogram shows many, many, many new arteries.
New arteries!
Coming from the left side to the right.
I love this.
You can see the metal wires holding my chest together after the surgery. Underneath there, that should have been an artery, but there are all these arteries, and they're bright, and they're clear, and they're bigger, and it's just amazing. My very conservative cardiologist, after seeing this, has said many times, I think this is what's keeping you alive. Keep doing EECP.
Oh, I guarantee, good grief, you can't walk around with 75% occlusion and 100%.
You can't climb mountains.
No, and you can't walk. I mean, we know people can't even make it from the couch to the bathroom. So you are definitive proof that this is successful.
I was so grateful for actual, you can say to somebody, I feel so much better.
Right.
Everybody ought to know this.
Right.
But it's totally different to be able to say,
I have
proof.
Look at my picture.
Yeah.
I don't have,
I ought to wear it as my badge of honor.
You really should. So coming back, in the next 5 to 10 years.
In the next 5 to 10 years.
What is the goal?
Okay. One of the things that happened, my sister likes to laugh about this because she said, halfway through my therapy, I called her up and I said, it's not available very many places. There was one in all of Denver. There's none in Utah that now treat heart for heart. And we have a brother in Utah who has heart disease.
Right.
Our only surviving brother. And he already has stents, and his cardiologist said, I'm just trying to keep you alive long enough for more medicines to be developed. And so I called her halfway through my treatment in Denver, and I said, he was not in a position to come to Denver to be treated for 7 weeks. His wife was in chemotherapy.
Oh my
and
gosh.
I said,
oh my God.
I am buying a machine, and it's going in your living room.
She said, okay.
She's a good sport.
She is a good sport. I've met your sister. I love her.
Let's empty the living room.
Move the couches back.
Move the couches. At least Frank can be treated there.
Yes.
And so my son, bless his heart, he has a chain of surgery centers. And so he knows a lot about medicine, a lot about regulations and dealing with Medicare and Medicaid. So I went to him and I said, tell me everything I need to know.
Yeah,
and so,
how do we do this?
Yeah, I don't think I would have dared do it without his knowledge about, because it's so complex, the regulations.
Oh, I bet.
But we recruited a medical director, which we needed to buy the machine.
Okay.
You can't get one without a medical.
Okay, so you have to have a medical director. You can't just buy them for your, even though they had it in the living room, they still had proof and they had the proper authorities.
It never made it to our living room.
Oh. Well, yeah, or Lenore was like,
yeah. So anyway, we did open a clinic in Draper, Utah.
Yes, tell me about this.
Yes.
Thrive.
Yes.
Thrive. It's in Draper.
Thrive EECP. And my goal is I just want to share this information with other people. I want everyone to know that this therapy can save lives.
Well, and you want to get it out to the general public, yes, but you also want to collaborate and create relationships with these cardiologists, you know, going in and saying, hey, we're not taking, these are people that you can't do anything for, and maybe start there, and then it can kind of evolve into the, well, maybe we should get tested so that people don't ever have to, I mean, you know, but, you know, the no option people should at least have this, and they should have a referral open to you guys, building that kind of relationship.
Just like Dr. Khan, he was open to saying, you know, try this, because he was not invested in some other therapy. And yes, I hope that it can be like dialysis, that we can offer it to everybody. Everyone should.
Yes, we do need to get it out.
I want to do anything I can to help other people know. Karishma, it is no, I just have to, when I finally got treated, and it took me referral to another referral to another referral, they would not even return my phone call for 4 months. And I finally got in to see them because one of their doctors said she ought to be treated. I thought it was because they were so busy, they didn't have time for me. I was their only patient. And they do use it. They use it for their doctors as a service to them. But it's a money loser to them. They don't want to do this.
I think that there just needs to be a paradigm shift. There needs to be a collaboration. And how do we get it out? We tell people about it. We encourage people to look up EECP. If you have a family member who's in this, or if I'm all about this preventative checking for the LPA, is that what it's the LPA? I mean, I'm all about that. Like, go and get checked.
It's a simple drug test. I mean, it's $25 to add it to your lab panels.
This is something that I'm feeling like somebody out there that has more time than I do to like incorporate a business around this that doesn't have to be even, I mean, you know, just...
Wait a minute. This is what we're doing. Let me say a word in defense of the cardiologist who did it. And because I am so grateful. I felt like crying when I found it. I really did, because it was like, this is my last hope.
Right.
What else is there out there?
Right.
And so they were pulling people off from their surgery teams to treat me. And Medicare does not reimburse well. They do reimburse, but not well.
Sure.
It is a money loser for them.
Well, but it doesn't have to be. They can, just like we were just discussing, this, the kidney disease, the dialysis. We can, that is what Thrive is to the cardiologist. Right. That is what, they're a separate practice under the medical, you know, you do have the authority, you've gone through all the proper channels and paths to be able to do this, but you service people so that they can continue to do what they need to as the cardiologist over here, and you can service the people over here. I think that that's like a, you know, what do they call it, a symbiotic relationship?
Yes, disruptive technology.
That's
technology. What they call it.
I love that. So, you know, where people are still doing what they need to over here, it's not taking away from them, but we just have this opportunity over here to save 1.8 million lives. I mean, that's not a small number.
And in India, there are pictures of China and India that they have, it's like an ER wing. You walk in and there are 20 beds, 20 little units, and that's when you can really make it efficient.
Right.
That you have to have 5 or more beds with 1 or 2 therapists in order for it to really make sense. And we may someday get there, we may not.
I say that we will. I like to say we will for these kind of things. I think that that's important.
And I think it's important, I want to stress that for me personally, I'm not in this to make money. I am, next week I'm 78 years old.
Wow,
And,
look at her. Wow.
I have 18 grandchildren. It's EECP. By the way, that is Enhanced External Counter Pulsation. And it's a weird name, but it's actually descriptive because it's counter pulsation working with the heart that's external.
Right.
And that's all it is. But it's got this huge long name. But I don't take any salary. I work 10-hour days. I have 18 grandchildren.
Right.
But honestly, I know a lot of people are people of faith. And when I prayed about it, I just felt like this is what I needed to be doing.
This is what you need to be doing. And next, we are writing a book about EECP. Tell us just a little bit about that. As we, this is the wrap up of this interview. Is tell us about your book.
Well, because I've done so much research on it and tried to find out everything I can, and I am not a doctor. I'm not giving medical advice.
No.
But I am a dedicated researcher.
You're informing.
Right. And so when I looked at the literature on it, trying to find out more, there are lots and lots of studies written for professionals, but the last book that was written on it was in 2006.
Oh.
And that's 2 decades old, and it's still selling copies. It is still selling copies, which says something. And on Amazon, they're searching for it. Some of our clients, we treat people who've come in. People call us from Arizona and California, and one from Colorado.
Right.
And they said, we called the clinic in Denver, and they just said they're really not interested in treating us. We're not their patient.
Oh.
And so we have people searching online for this,
Right.
who are beginning to realize or have learned about it some way. But everybody needs to know about this. Everyone deserves to know about it.
I'm so excited for your book to come out so that we can highlight it again when you come back on our show. And I just thank you so much for all of this information. I mean, this is life-changing. Life-changing, and in a lot of instances, life-saving information, which I love that you're championing, that you are a champion of this, that you are pushing something important to the forefront. For strictly informative and helping others, that is your motive. And what better reason to give information to, so my hat is off to you.
Thank you.
Again, Thrive is in Draper. They do a lot of healthcare things, but they also, this is the most important, is they have an EECP machine. Here in Utah, for anyone who is in the no option, anyone who wants to come and have, it's not just for people who have angina, although there is you can't have blood clots, you can't
be pregnant, have uncontrolled high blood pressure.
Uncontrolled high blood pressure. So of course, they're going to ask all these questions to vet you, but if you are looking to enhance your life, even if you don't have heart disease, these machines can actually enhance your life for the good.
Yeah, my sister's husband has Parkinson's, and we've been treating him. And before, he was walking and he was dragging his left leg and his arm was stiff. And afterwards, he could walk forward, backwards, he could wave. He went back to work, he was able to climb stairs. It won't reverse his Parkinson's. But
Sure. But this is an enhancer of your life. This is an enhancer. So again, thank you so much for joining me. Any other questions? We've got a phone number at the bottom. You'll be able to call them. They are in Draper. Thank you so much for joining us.